Hi all my wonderful TM joiners, I'm Priya Mistry, the TMJ doc. Today's video is about the best sleeping position if you suffer from TMJ disorder. Many of you have been asking me about this, so I thought I should make this video for you, my dear friend, so you have some more information. Please be sure to watch until the end because I will also be talking about the best pillow for you if you have TMJD. Before getting into it, make sure to check out my other social media accounts. I post a lot of useful information, tips, tidbits, trivia, and pain relief techniques on those avenues as well. For those of you who don't know me, I'm a general dentist with a practice in Vancouver, Washington, where we are dedicated to taking care of patients with TMJ disorders. So now let's get right into it. Which sleeping position is the best sleeping position? So right off the bat, I always discourage people from sleeping on their backs. The reason that sleeping on your back can be sort of detrimental if you have TMJD is because oftentimes one of the causative factors, what leads to TMJ problems, is obstructive sleep apnea. What is obstructive sleep apnea, you ask? Obstructive sleep apnea is also called OSA, and to quote directly from the Mayo Clinic about what it is, quote, obstructive sleep apnea occurs when the muscles in the back of your throat relax too much to allow normal breathing. These muscles support structures including the back of the roof of your mouth, soft palate, the triangular piece of tissue hanging from the soft palate, uvula, the tonsils, and the tongue, end quote. What happens is that when we sleep on our backs, gravity pulls the weight of our jaw and therefore our tongue, which is attached to the jaw, further back into our airway, thereby making obstructive sleep apnea worse. Basically, sleeping on our backs makes the airway smaller and makes OSA worse. When OSA is an issue, our bodies will go into fight or flight mode. So when we are struggling for oxygen at night, our bodies go into that fight or flight mode, which is a very stressful mode for our bodies to be in. That will then sort of encourage us to clench and grind. When we're stressed, many of us clench our teeth. We're just sort of designed to sink our teeth into whatever is bothering us, and grinding the jaw forward actually opens the airway. So just like the CPR chin tilt technique to open the airway, grinding the jaw forward accomplishes the same thing. So it's our brain's way of kind of knowing, hey, if I grind the jaw forward, I can get more oxygen into the system, essentially. All that increased clenching and grinding activity will then negatively impact the muscles of the head, neck, and jaw, as well as the jaw joints, leading to TMJ issues, including but not limited to headaches, jaw pain, neck pain, ear pain, clicking or popping noises in the jaw joints, and even jaw locking. So suffice it to say, I don't recommend sleeping on your back if you can avoid it. Another position I don't encourage when we're sleeping is sleeping on our stomachs. When we sleep on our stomachs, we have to twist our neck right or left on our pillow just so we can breathe, so our nose and our mouth are exposed to the air, if you will. If you've seen my video called Neck Pain and TMJD, which I've linked above and below, then you know that I talk a lot about how the neck and the jaw are intimately related. And along with OSA, obstructive sleep apnea, another factor that can often cause TMJ issues is actually the neck. So whiplash injuries, other types of injuries to the neck, misalignment of C1, this first cervical vertebra, all of that can feed up and affect the jaw. I can't tell you how many patients I've seen that have suffered a whiplash and suddenly their joints, their jaw joints start clicking and popping, or even worse, sometimes the jaw will actually lock closed after a whiplash injury. So I will always encourage anything that will decrease the strain on your neck. This includes not sleeping on your stomach. As kind of a quick side note to that, I have a lovely patient who comes to see me. Her jaw was locked closed when she first came to see me. She could barely open more than 1 or 2 finger widths and she was in a lot of pain. And she responded to treatment really quickly at the beginning. She unlocked quickly. We were able to really gain a lot of traction and get moving on treatment. And then all of a sudden she came back to me and she was locked again. And I said, what happened? And she said, well, I was actually putting pillowcases on our pillows at home after washing the sheets. and I held the pillow like this between my chin and my throat. All of us have done this, right? And then I put the pillowcase on. And after that, her jaw locked up again. So it was something as simple as like an everyday task that we've all done, but it was just too much for her neck, and that fed up and really affected her jaw. So part of her treatment became daily neck stretches, which have actually sort of helped her unlock again, and we're on the right track again. But I just found it so fascinating that a simple, quick task like that can just throw everything out of whack all over again. So back to sleeping. So really that leaves us with sleeping on your side, either side, as the best sleeping position if you have TMJD. The only thing I discourage when you're sleeping on your side is please do not rest your hand against your jaw. So if you saw my thumbnail for this video, that's exactly what I'm doing, but I didn't really know how else to look like I was sleeping in the thumbnail besides that, but I really discourage that. So I really discourage placing your hands against your jaw when you're sleeping on your side. And the reason for that is what it does is it puts too much lateral pressure on the whole jaw. Our jaw joints are not built for a lot of side-to-side movement. They're not built for that lateral movement. They're built for up and down and forward and backwards. And that lateral movement can actually make some muscles and the joints themselves pretty mad. So we want to avoid having our hands on our face. Many people have told me that sleeping on their side makes them feel as though their hips are sort of imbalanced, and I totally get it. That's how I felt during both of my pregnancies. So sleeping with a good pillow between your knees or your legs is a good way to sort of counteract that, and I've linked the pillow that I used during both of my pregnancies in the description box below. So that leads us right into pillows. Which pillow is the best pillow? Well, my friends, I wish I had a good answer for you, but my answer is this. The pillow that gives your neck the most support without causing neck pain or neck strain, that is the best pillow for you. That pillow is different for me than it is for you, than it is for the next person, and that's the tricky part. All of us need kind of different levels of support for our necks, depending on what our necks have been through. Some of us have suffered many whiplashes. Others of us have not. Some of us have hypermobility. Others of us do not. So that's why I can't give you a really straight answer like, go buy this pillow. This is the pillow for you if you have TMJ issues. I would recommend sort of experimenting with a few different pillows. And so I'm not saying break the bank, but maybe get one that's a softer pillow, like a medium firm pillow, and then a firm pillow, and try them out. And many stores will let you return pillows as well, so you can kind of try it out and then return it if it doesn't work out for you. I'm currently investigating and trying out new pillows, just to kind of provide some options for some of you out there. So if I find something I really think will be helpful, I'll be sure to make a video on it. So kind of stay tuned for that. Keep an eye on my channel. The best way to do that is subscribe. Hit that subscribe button and you'll get a notification for my new videos that come out in the future. In the meantime, I wish you good luck for finding the perfect pillow for you, my friends. I know that I myself sort of went on quite a search before I found the one that suited me best, and I am very happy with it. It was well worth the wait. So that's really it, my friends. Again, I'm Dr. Mistry, and I hope you found this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. For TMJD relief from the comfort of your own home, please download my free PDF guide called 3 Steps to TMJD Pain Relief. You can find this on my website, which is linked below. If you go to the home page, just scroll to the bottom and it's right there. Keep in mind that questions and comments are always welcome. I'd love to hear from you. If you have a pillow you feel strongly about, feel free to share that below. If you try out sleeping on your side, let me know how it goes. And remember, my friends, you can never have TMI about TMJ. Thank you.